Hello, Mr. Grayson.
Yeah.
Hi. How are you doing today?
Well, not too bad. I don't know what all the fuss is about.
Okay, well, my name's Dr. Silver. I've been asked to come and see you today because I've heard that you might not have been feeling well.
I'm not ill.
Okay, well, how have things been? I'm just come to see you at your home. I realise you've just been living here for a while now. How
Yeah.
are things?
They're all right. They're all right. They're not brilliant, but, you know, I'm not too well, am I?
Well, that might be the case. I'm just come to find out, actually, how you are. But I just wanted to find out how things have been at the home at the moment. How are the people here? How's the staff?
They're all right, but some of them are a little bit funny, you know, talking and stuff like that.
Okay, can you tell me a bit more about that?
Well, just, you know, what they say about me and stuff, you know. They're supposed to make me better, aren't they, you know, with my cancer and that, and they're just trying to make it all worse.
Okay, how are they making things worse for you?
Well, just, you know, with those things they have, you know, those special sort of pen things.
Can you tell me a bit more about the pens? I'm not sure I know what the pens are.
Well, it's like a special pen that she has, you know, and it's got this special stuff in it, and it just makes me ill.
Okay, and who's she?
My psychiatrist.
Okay, so she's got a special pen.
Yeah.
And what does that special pen do to you?
Well, she's got this pen. I've not seen any of the other doctors. They don't have it. They have like normal pen you buy in the sweet shop, you know. She's got like a special one, like a fountain pen.
And what does she do with the pen?
Well, she's got this special sort of black ink in it or something. It looks like ink.
No, sounds quite scary for you.
Well, yeah.
What did she do with it? Does she somehow use the pen on you?
Yeah, she has done. She gave me schizophrenia. She injected me with it.
Okay, so she injected you with schizophrenia.
Yeah.
And has that changed your body at all? Has it changed your thoughts?
It's given me cancer.
It's given you cancer. Okay, that
Yeah.
must be quite frightening.
Well, it is
for you.
frightening. Yeah.
Okay, I'm sorry to hear that. How long have you been feeling this way?
Well, it's been a few months.
Having the thoughts that your psychiatrist is injecting you?
Well, she is. Because none of the others have that. They have a proper pen. She's got this special one that she takes out of that bag she wears, you know.
Right, okay. And is there anyone else here at the home that is interfering with your body in any way or poisoning you?
Well, they tried, didn't they, in the food and everything they give me.
The staff are trying to poison you with the
Well,
food?
yeah, I can hear them. They're talking about me and stuff. I can hear what them. I'm not stupid. I can hear what they're saying in the corridors and that.
Okay, and what kind of things are they saying about you?
Well, just things like, well, not long now. Give him a bit more. Things like that.
Okay, and do you hear these voices inside your head, or is it like I'm talking to you now? Do you hear the voice?
Well, not inside my head. It's like you talking to me now.
Right, and how many people are talking to you?
No, 2, 3.
Okay, and it's not you're sure it's not your own thoughts?
I can hear him in the corridor, the room next door. It's as clear as I'm hearing your voice now.
Is there ever a time that you feel that the staff or your psychiatrist are putting thoughts inside your head?
No, I'm not sure they can do that, but you never know because they have all this equipment, don't they?
Okay, I'm glad you don't think they can do that. And are there ever times you feel that they might be able to take thoughts out of your mind?
No, I don't think so, no.
Okay, and are there ever times where you feel that people can read your mind or read your thoughts?
I don't think so, but they have special powers, don't they, sort of people?
Okay, what kind of special powers do they have?
I don't know, but anyone that works for the government, they have all these sort of devices, don't they? These special devices to do things.
Okay, well, it all sounds rather distressing. Are there any times where the voices tell you to hurt yourself or anyone else?
No.
Okay, that's good, that's good. Have you been taking your medication, Mr. Grayson?
No. I haven't.
You haven't. How long have you not been taking it for?
A few months.
A few months. And how is it here that you're not taking it? Are you taking it yourself, or do the nurses give you the medication?
They give it to me. I pretend to take it, but I don't take it.
Okay. And have things been getting worse for you since you stopped taking the medication? Have you been feeling more anxious or more worried about some of these thoughts you've been telling me about?
Well, I'm worried, yeah, because of all the things they're doing to me, yeah. You know, my arm and everything.
Your arm? What happened to your arm?
Well, you can see it's smaller, isn't it?
You believe that your left arm's smaller than your right arm?
Well, it is. I've measured them. The left arm's much smaller than my right arm. I measured round here and everything. Look, it's everything.
They actually look the same to me.
It's not. I've measured it. It's a lot smaller.
How has this affected your mood? Are you feeling quite depressed at the moment? Or
No, I just don't take my medication because I don't want them to speed it up.
Right. Okay. Fine. I see. Well, is there anything else that's worrying you or anything else that's on your mind at the moment?
Well, no, I just want to, I don't want them speeding it up. I just want to be myself, and then I'll get better if I stop taking it, won't I?
Okay. And could there be another explanation for all these thoughts that you're having?
Well, I don't know. I don't know the sort of things that the government do. I don't really know.
Could it be your illness that's creating these thoughts, do you think? The schizophrenia that you've been diagnosed with, might that be an answer as to why you're having these thoughts that people are after you and poisoning you?
Yeah, but they're doing it, aren't they? They gave it to me.
Okay, so you're telling me that it's not your illness, it's definitely happening.
Well, yeah, because I've heard them. Yeah. I hear them clearly, just I say like you,
Okay, it all sounds quite distressing for you.
Yeah, it is. It's worrying. You just don't know what to do you, really? Because what do you do when I'm in here? I've got no choice, have I?
Okay, well, thanks a lot for talking to me today. I think we're going to be able to help, and I think we're going to try and work on some of these thoughts and try to alleviate some of your anxiety about them.
Right.
Does that sound good?
Yeah, if you can help me, yeah.
Okay, we'll definitely try.
All right.
Okay, thanks for meeting with me.
All right, thank you.
Okay. As you can see, I've just tried to meet with the patient and explore the mental state and elicit any psychopathology. Sometimes when you walk into the CASC examination, the patient may not want to shake your hand when you try and introduce yourself, which can often provoke a lot of anxiety within yourself when you've prepared your introduction and you're suddenly thrown like that. The best thing to do is just to carry on as normal, stay calm, sit down, don't try and shake his hand again or her hand, and continue with your introduction and just say who you are and why you're there to see them.